Hello everyone, welcome to this In-Step Physiotherapy video episode. This is a special episode, Rewiring the Brain, a new hope for Functional Neurological Disorder. Imagine waking up one morning unable to walk properly. Your leg feels weak, your balance is gone, and your hand shakes uncontrollably. Your speech becomes difficult. You rush to the hospital. MRI shows normal. CT scan shows normal. Blood test normal. Yet your symptoms are very real, very frightening, very disabling. And then someone tells you everything looks normal. For many people living with FND or Functional Neurological Disorder, this is where the frustration begins. But what if I told you that your symptoms are real, your conditions are real, and most importantly, your brain has a capacity to relearn and recover? Today, we are exploring one of the most exciting areas in modern neurorehabilitation. How we use a brain-based physiotherapy approach to help people with FND regain movement, confidence, and independence. I am Giri Srinivasan, physiotherapist with a lot of special interest in neurology and also member of Functional Neurological Disorder Society. Actually, we have a FND's 6th International Conference happening in Baltimore, Maryland this weekend. I am attending it online. So it will be very interesting to know what are the recent advances and what the people around the world are doing and the knowledge transfer which we can apply directly for our patients. And welcome to In-Step Physio, Neuro Rehab Clinic and also Orthopedic Rehab Clinic, where we treat a lot of FND patients and also other neurological conditions like stroke, multiple sclerosis, spinal cord injury, brain injury and everything. And another exciting news is we opened a new clinic called Next Step Physio and Neuro Rehab Clinic in the south side of Edmonton. So a lot of these years, my patients always complain, Giri, you're always in the downtown, you have to travel all the time there. So we opened this clinic in south side. So anybody needs neurological rehabilitation in the south of Edmonton can go to Next Step Physio and Neuro Rehab Clinic, which is located in a beautiful new Covenant Wellness or Covenant Health Group building across the Milloots Rec Center. Beautiful building, we are on the ground floor, free parking, and the clinic is set up for neuro rehab with parallel bar, low mat, and neuro-trained physiotherapists out there. So give us a shout if you need neuro rehab in Edmonton. Whether in the north or south, we are there for you. So what is FND really? Let's begin by clearing up one of the biggest myths. FND is not fake. And it used to have a different name before. We used to call it as a conversion disorder. So FND is not imagined. It's not attention seeking. It's not all in your head. Functional neurological disorder is a genuine condition in which the brain struggles to properly send, receive, and integrate signals involved in movement, involved in sensation, balance, speech, and other neurological functions. Symptoms are involuntary and can be profoundly disabling. Modern rehabilitation focuses on retraining brain-body function rather than finding structural damage. Sometimes in neurology, you do not need a diagnosis. You can assess a patient, find out what's going on, what are the symptoms and dysfunctions, and you can put a treatment plan for that. Sometimes I find patients wait months and years to get a diagnosis before they come to us for rehabilitation. It's not always you need a diagnosis to treat a patient. Diagnosis is just collection of symptoms. So just remember that one. I often explain to our patients in this way about FND. Imagine your brain is like a highly sophisticated computer. The hardware is intact. The screen works. The keyboard works. The processor works. But the software has developed glitches. The system is not damaged. The system is not broken. The system is not communicating efficiently. That is the lens through which we view FND rehabilitation. A real patient story. Recently, I met a young woman who arrived at her clinic in a wheelchair. She's been in the wheelchair for 2 years. She's seen multiple specialists, multiple investigations, multiple opinions. Every test looked normal. Yet, she couldn't walk independently. Her confidence has disappeared. She told me, Giri, nobody believes me anymore. That statement broke my heart. Because one of the biggest challenges with FND is not just the symptoms. It's a feeling of not being understood. Over several months, we worked together. Not by focusing on what was wrong, but by focusing on what was still working. Little victories became bigger victories. Standing, weight shifting, stepping with assistance, without assistance, walking in the parallel bar, walking outside with crutches and canes and walker, and then without support. Eventually, she walked independently into the clinic. Not because we fixed damaged tissue, but because we helped retrain neural networks. We helped the brain feel safe for her to move. And that's what gives me tremendous hope for people with functional neurological disorder. So now, we'll try to understand FND through the brain lens. Modern neuroscience is teaching us that movement is not controlled by one part of the brain. It requires an entire network. When the network becomes disrupted, movement can become unpredictable. Let's look at 5 major brain systems which is involved here. Number 1 is a frontal lobe. The frontal lobe is a movement CEO. The frontal lobe helps initiate movement. It's a part of the brain that says, let's stand up, let's walk, let's reach. In many people with FND, movement becomes over-controlled. The harder they try, the worse the movement becomes. Interestingly, research and clinical experience show that automatic movement is often better preserved than consciously controlled movement. I'll repeat that again. Research and clinical experience shows that automatic movement is often better preserved than consciously controlled movement. Specialized FND physiotherapy often uses distraction, rhythm, automatic tasks, and functional activities to access more normal movement patterns. These are all the part of your treatment plan. So as neurophysiotherapists, we might use walking while talking, walking to music, stepping over obstacles, throwing and catching, dual task activities. Because recovery often happens when the brain stops overthinking movement. The other part of the brain we got to discuss here is the parietal lobe. The body's GPS. This area tells the brain, where am I? Where are my limbs? How am I moving? Many people with FND develop altered body awareness. The brain's internal map becomes less accurate. That's why we use balance retraining, sensory weighting, sensory retraining, weight shifting, eyes closed activities, and body awareness exercises and body mapping. We are helping the brain to rebuild its GPS system. That's one of the things we do for FND patients. And then we go into this another part of the brain, the temporal lobe, the pattern learning center. As physiotherapists, we are the specialist in pattern recognition. That's what we do. We have eyes for that. When you recognize a pattern, sometimes you don't need diagnosis. The temporal lobe helps create habits, patterns, and motor memories. Sometimes FND creates unhelpful movement habits. The brain learns a protective movement pattern. The challenge is that brain pattern keeps repeating. Our goal is not to fight your symptoms. Our goal is to teach the brain a new pattern through repetition, through rhythm, through success experiences, through confidence building. Yeah, that's about your parietal lobe. Let's move on to the occipital lobe, the visual guide. Did you know your visual system plays a huge role in movement? Many FND patients move better when provided with external visual cues actually. Targets, lines on the floor, mirrors, objects to step forward. The visual system helps organize movement in ways that bypasses dysfunctional patterns you develop. Next, we're going to the interesting one, the insula and the limbic system. This is the big one. These areas help determine whether the brain feels safe. Remember, the brain's primary job is survival. Not happiness, not fitness, survival. When the nervous system becomes overly protective, symptoms may become amplified. You can have weakness, tremors, dystonia, fatigue, dizziness, seizures, pain, movement avoidance. All these things can happen. FND patient can have cocktail of symptoms. Every patient is different. No two patients are same. So we do not have a cookie cutter program to treat your FND. Each and every patient gets the individualized FND rehab plan. The brain is trying to protect you. The problem is that it's protecting you too much. Our job is to teach the nervous system that movement can be safe again. Education, graded rehabilitation, and shifting attention from symptoms towards functional recovery are central principles of modern FND treatment. Why traditional exercise model fails these people? This is one of the biggest mistakes in FND rehabilitation. People are told, strengthen your leg, do more repetitions, push harder. But FND is not primarily a strength problem. It's often a movement control problem, a brain network problem. If someone with FND can suddenly move normally when distracted, but struggles when focusing on the movement, strength is not the primary issue. FND-focused physiotherapy, therefore, emphasizes restoring automatic movement patterns rather than simply increasing effort. That is why FND rehabilitation looks very different from stroke rehabilitation. Different principles, different strategies, different goals. The Instep Physio FND approach, it focuses on understanding the diagnosis, understanding the person behind the diagnosis, understanding the exposed trauma, understanding their safety net, understanding the fear, and building confidence, reducing the fear, retraining automatic movement, improving their sensory processing, balanced retraining, functional task practice based on what is your goal is, what you want to get back to, graded exposure, fatigue management, pain management, and most importantly, restoring hope. Because hope is often the first thing FND takes away. We are not doing it alone. We are a collaborative practice. We have physiotherapists, we have massage therapists, we have kinesiologists, psychologists, we have occupational therapists in our team, SLPs. We have a team behind your recovery and success. We coordinate with your physician, with your neurologist, with your healthcare practitioners, with your family, and with you in the center. That is how we get good results. Another powerful story I want to share with you here is this gentleman came to us after months of fluctuating symptoms. Some days he walked, some days he couldn't. He had stopped going to family events, stopped exercising, stopped living. He became trapped by the fear of what might happen. One day, during therapy, we started a simple ball toss activity. While focusing on catching and throwing the ball, his walking pattern became dramatically smoother. For the first time, he saw what was possible. The moment that changed everything. Not because he was cured instantly, because he has finally saw evidence that recovery was possible. And recovery always starts with possibility. So, our message to families, if you are a family member watching this, please understand something important. Your loved one is not pretending. They are not choosing these symptoms. They are not lazy. Their symptoms are real. Your support can make a tremendous difference. One of the strongest predictors of recovery is having people who understand, encourage, and support the rehabilitation process. Family involvement and focusing attention on function rather than the symptoms are important components of FND recovery programs. So, what's the big takeaway here? If you remember one thing from today's episode, remember this. FND is not a sign of a damaged brain. It is a sign of brain network that needs retraining. And the beautiful thing about the brain is that it's adaptable, it's changeable, it's trainable. The ability is called neuroplasticity, and neuroplasticity gives us hope. And there is a myth out there spreading in the cities. When patients come and tell me, I'm really shocked to hear this, is people are telling, oh, after 2 years, nothing will change. You will not improve. That is not true. Your brain neuroplasticity does not have an expiry date. Even after 10 years, you can make a change. Believe me, you can. So, if you or someone you know has been diagnosed with functional neurological disorder or FND, if you've been told your scans are normal but your symptoms are very real, if you have lost confidence in your movement, if you have stopped doing the things you love, please know that recovery is possible. You do not have to navigate this journey alone. Our team at our Instep Physio and Next Step Physio and other clinics provides specialized neuro rehabilitation programs and designed to help individuals with FND to retrain the movement, to rebuild confidence, and to reclaim their lives. So, reach out to us, book an assessment, ask questions, learn about our FND recovery program, because the goal is not simply to manage symptoms. The goal is to help you to move freely, live fully, and believe in your recovery again. I am Giri Srinivasan. Thank you for joining us. And remember, the brain that learned the problem can also learn the solution. See you in the next episode. Bye.